Lately, I've been hearing a lot more news around me about people getting diagnosed with cancer, and it's made me question life a lot more. Are doctors really lifesavers? On this episode, I'm following Dr. Su Jun to see what a patient goes through in their journey to find life in the face of possible death. I'm Wendy, and this is Hidden Hustles.
So we are seeing this middle-aged Malay lady who came to see us with a breast lump on the right side. Unfortunately, we found that actually she has breast cancer, which has spread to the liver, which unfortunately puts that as a stage 4 breast cancer.
So basically, she is here late-stage cancer, but she won't be going for surgery.
Yeah.
She will just be kind of receiving the chemotherapy, radiation therapy to help her kind of extend her life.
In a sense, and also to control the disease. The consensus was for chemotherapy alone. Okay. Vitals are stable. Okay, well, that's good. You all have seen the wound already, the dressing room. Okay. Let's go and talk to her. Hello.
The chemotherapy start already, okay?
Not really like inside. I count down that I cannot eat. There is tofu is very different.
Belinjal.
Now yes,
Then you can eat. Is it? You feel better if you eat that?
better than I take the porridge.
Just frequent small amount.
Yes, yes.
Yeah. This one how long already the swelling?
I think 3 days.
3 days. This side, right?
Yeah. And still getting bigger.
Oh, I think we need to get an
You should get
ultrasound.
ultrasound scan.
Yeah, the right side is worse.
They do the scan.
Do you ever feel like you are kind of handing out death sentences? To me, when I think of like cancer, I think my immediate thought is like, oh my gosh, it's a terminally like ill disease. It's something that I don't think can be cured.
So, I mean, I kind of see it the other way. That actually I am offering them treatment options so that the cancer doesn't take them away. Yeah.
How does it affect you?
I mean, as a fellow human being, you will empathize with them. It does take an emotional toll, but as a doctor, you do have to maintain control of the situation, and that's the most important. Yeah, to kind of still be able to encourage the patient despite a very life-changing kind of diagnosis.
Thank you. So I go to room 10.
Dr. Su Jun's thoughts left me pondering.
Okay, sure. Thank you.
And as he goes to prepare for surgery, I spent some time with former nurse clinician Madam Lei Hun, who's here for her routine checkup. So you were here for your X-ray, I heard?
Yeah, X-ray, then followed by the doctor consult. Then later I will be getting my injection.
What's the injection for?
Just to prevent the cancer from spreading further. So every month I need to come for injection. 2 jab here. Very painful. Very painful. Way before I had this cancer, I was also a nurse clinician. So I do counsel other patients, those male patients with cancer prostate. Yeah, so to me at that time, cancer is just a word on my skin. It didn't pierce through. It didn't know that I need to face and I need to journey, I need to go through this.
Hello, good morning.
Tao là hó, Vito là hó. Okay. When I was J1, My grandpa passed away. Very advanced gastric cancer. And that was a big thing in my life. So he went for surgery, we saw him get more and more debilitated. Eventually passed on. So that kind of impacted me because I was quite close to him. I wanted to do something that would impact other people's lives in a meaningful way.
So right now they are doing surgery, which is a full mastectomy of like the right breast, and I've obviously never seen anything like this before, so it's quite graphic. But yeah, the good thing is that the doctors are all very calm and all very sure, and it makes me feel very assured.
Sometimes the surgery itself is the one that prevents the patient from dying. And the surgery can mean life or death for the patient.
But does it also get stressful because your job technically is to save someone's life, and like, how do you cope with that?
You kind of have to tell yourself that you've done whatever you could have done. Sometimes, despite your best efforts of yourself and your whole team, you may not be able to save the patient's life. I mean, we start off all being very optimistic. Yeah, fresh-eyed junior doctors. But you kind of learn that there are some limitations of what you can do. If anything, in the past 9 years, I have learned to be more mentally strong for the next patient. Because it's easy to sink into a state of anxiety or sadness. But it's important to understand that you have other patients waiting for you.
As I leave Dr. Su Jun to attend to the rest of his patients, I meet back with Madam Lei Hun, who is getting her cancer treatment done.
We're gonna clean it, and then we are going to put a needle through it.
Okay.
And then we're just gonna flush it.
Do you get nervous?
Initially, yes. Now, not too bad. Yeah.
Initially, as in because it's new, or?
Initially, it's because the sight of the needle really make me like very, stressed out. Yeah. So and the pain also.
Relax first, huh? 1, 2, 3. Take a deep breath in. There we go. Very good.
Like, does it help you in your journey because you were a nurse before? Like, to kind of understand everything, the procedure, what they're doing?
Yes or no? Yes, in such a way that I know what they are going to do for me next. But then with too much knowledge also, it also make you a bit anxious. That's like, eventually I need to face death. But it's how much I'm preparing. So I'm going to like so-called live happier with my children. Yeah, spend time with them, go out with my friends, eating. Yeah.
So your name is Anna.
Anna.
Anna and
Elvira.
Elvira. So you both came down to support with him. Aww.
As a treatment today.
Right. Do y'all come every month?
Tan Tock Seng is like our second home.
Then we come on different days.
So
Right.
if we happen to meet, then we say hello, then we have coffee, just to chit chat.
Sometimes we'll meet with other survivors also.
Yeah. So when was the last time, or when?
Diagnosed in 2015 April,
When were you diagnosed as well?
December 2013.
December 2013.
So this coming December is my 10th anniversary.
so big enough for us.
So is it a big thing for cancer survivors?
Yes.
To like 10 years remission. Yeah. And for
There is a stigma that cancer is a killer, right? But nowadays it's no longer a killer. You see us, we still survive.
Yeah, some
Almost 10
cancer,
years.
breast cancer, they are scared. Really.
Yeah.
So it's the early detection that matters.
As early as possible. That's why increase the awareness of breast cancer. If there is abnormality there, please go quickly check.
what do you feel is the most rewarding part of this journey?
We are able to overcome all these difficulties, Then we get new survivors,
Have a chance to live.
live happy life.
Yes.
Yeah. So we are very happy in fact, enjoying life.
Don't take everything for granted. That is more
So you
important.
see how happy we are, laughing all the time. Right?
After going through all these years, interactive patients and being in surgery, has it changed your perspective on life?
I think it has. You learn to kind of treasure the little things in life. I find fulfillment mainly in I'm able to tell them, oh, your cancer has been removed. You can go back to your usual life and all that. Go home, spend time with your loved ones, kids. And it makes the hard work worth it.
So this has been a topic that I've been thinking about doing for a while now, and I'm so thankful that Tan Tock Seng Hospital actually gave us opportunity to film and cover the breast cancer department, and gave us access so that we can also show a very authentic picture of what it is like being a doctor in this department as well. So thank you to Tan Tock Seng, and I hope you guys have enjoyed watching it and have gained as much insight as from watching the video as I have when I produced it as well. So as usual, if you guys would like us to cover any other jobs, let us know in the comments. But till then, we'll see you at the next hustle.